So hello and welcome everyone to this week's Data Talk session hosted by the European Data Portal together with the Support Center for Data Sharing. These are two of the projects that we run together with a consortium of partners in name of the European Commission. And in these Data Talk sessions, we want to have an informal discussion on different topics related to open data and data sharing with people that are enthusiastic and passionate about those topics. Last week, we had the first pilot session with Jelle Verburg from the Dutch Open Data Portal. And in case you missed it, the recording of the data talk with Jelle is already available online. Now, this week, we will discuss together with members of the European Data Portal for COVID-19 section, specifically the editorial team, their experiences on making COVID-19 related data and data-related initiatives discoverable, but also creating editorial content, which we call the so-called data stories, that provide more detailed insights on available data as well as initiatives, but also adding valuable visualizations of data to allow for easier interaction with the data. My name is Laura van Klippenberg, and I'm part of the European Data Portal team. And I also have been coordinating the activities for the EDP for COVID-19 section as well. I will be your host today, and with me are members of the editorial team, Pervin, Jetske, and Gautam, to discuss. And the editorial team is actually bigger, it extends beyond them, and some other members are also joining. So if in case you have any questions, we're all here to discuss the questions. So for those of you who are not yet aware of the EDP for COVID-19 initiative, it basically is a dedicated section on the European Data Portal, which we ran since April 2020, in which we manually check and validate data sets, and validate also that it comes from a reliable source. And this is really different from the European Data Portal's normal data section, which automatically harvests data from national open data portals. And by doing this, the team wants to enable European citizens to be informed about data that is reliable and to create a better understanding of the current COVID-19 situation. I would also like to ask you to briefly introduce yourselves, Pervin, Jetske, and Gautam. But before I do that, I also want to make a quick note that in case anyone has a question during the discussion, please feel free to either unmute yourself and pitch in the discussion, or if you're a little bit more shy, you can also type in the question in the chat and we will discuss your question or even give you the floor to elaborate. So then let's get started with some introduction. Pervin, would you mind briefly introducing yourself and what your background is?
Sure, thanks Laura, and thanks also for hosting us today here on this edition of the Data Talks. Really a pleasure to be here. So me, I'm Pervin Celik, part of the European Data Portal for COVID-19 section team, also since April. And I do have a background in strategic product design, and I'm currently working in Capgemini Invent as a customer experience consultant. But I have been involved with the European Data Portal project earlier in the year to improve the user experience of the portal. And then later I got more in contact, interested in the open data topic and also like the EDP project. So then I also was very happy to take part in the COVID-19 section.
Great to hear. Thanks for that introduction. Jetske, can I ask you to introduce yourself next?
Sure. Hi everyone. Indeed, as Pervin said, it's a pleasure to be here and to discuss the topic of open data, especially in the scope of the European Data Portal COVID section today. I personally have a background in business cases, but as I have a large affinity with data, I joined this project as well in April 2020. On the side, I also work on Invent for Society, where the European Data Portal for COVID also fits in, where we try and bring more awareness to the importance of social impact in the work that we do. And the European Data Portal for COVID, of course, helps in terms of well-being and having information on the virus. So that blends in well.
Yeah, nice. Also, indeed, good to point out that we, with this initiative, indeed want to add to being more transparent with data and showcase the value of data in this kind of situations. Thanks, Gautam. Would you lastly introduce yourself?
Sure. Good afternoon, everyone. My name is Gautam Jaikodi, and I've been working as a management consultant and a data scientist for the past 3 years, and I've been working on various topics. I've heard about the European Data Portal in 2020, and I was lucky to be a part of the team since April. And I've been helping the editorial team in visualizing the data sets that we find and also supporting the editorial pieces. So I'm really happy to be here in this data talk.
Nice, that's great to hear. And I actually also think it's quite nice to see that not all of you have a heavy background in data science. I mean, it's quite a various group of people that we have with different backgrounds. And it's also quite admirable that you've been able to, step up and be responsible for creating more insights from the data that is currently available and creating these editorial pieces out of it. And on those editorial pieces that you create, one of the data stories, as we call them, you wrote, you explored the historical role of data in epidemics and pandemics over the past century. And you also highlight how the role of data in the current COVID-19 situation is different. And I would like to ask you, could you maybe first tell me a little bit more about that historical role of data in previous pandemics? Perhaps yes, Jetske, you can tell me a little bit more about that.
Yeah, of course. So at the moment, we're of course used to having data on the pandemic all around us. And what we thought was quite striking is when we, of course, compared this to previous epidemics or pandemics, it looked very different. So in the data story, the power of data, or the everlasting battle basically between humans and the virus, we really saw that, if you compare it to the 1917 pandemic, which was a flu, then you see that data had such a small role, and that the means of data collection and data technology were so much further behind in comparison to what we are doing and achieving now. And what we thought was quite striking is that with the data collection, everything was still on paper. So say medical records, death certificates, etc. So what we noticed is that if you want to try and estimate how many people actually died in that pandemic, it's really difficult because there is no good track record. Whereas now, of course, at the moment, we see a very different situation.
Yeah, indeed, that's quite a complete change as opposed to the previous pandemics or epidemics that we have experienced. And to go a little bit more into the role of data now in the COVID-19 situation, could you tell me a little bit more about that in more detail? Maybe Jetske or Pervin?
So what I really noticed, and what we as a team saw when we were doing the research, is that data plays a huge role in the pandemic at the moment. I think everybody has seen it on the news, where you get daily numbers on exactly how many cases or how many deaths or recovery rates there are in each country. And we, of course, grew really used to this. We are sort of on top of the pandemic, and we know exactly in which country it's popping up now and where, sort of a hub is and a lot of infections are. And what I think is quite interesting is that data is really powerful in this sense, where you see a lot of new initiatives, which of course, if you would compare it to the past, wouldn't have been possible, where people work with, say, contact tracing apps in which we can also gather data about who is infected and who's not, and who have you been in touch with, which makes the whole process of trying to track and trace potential infections a lot easier. And I think if you really look at the essence of this, it means that we have the power to share with each other to what extent this or how this pandemic is developing. And we have the opportunity to act on this power and use it wisely to sort of enable our decision making.
Yeah, and also like maybe to add on that shortly, it's like, for instance, when you think of pandemics and epidemics, like one might think immediately about like the medical data. However, in the pandemic, we also have been experiencing like in a lot more different areas that the data is very prominent. So as Jetske said already, like with the contact tracing, it's now easy to see who you have been in contact with thanks to the data collection and technology, but also like there are a lot of, for example, it allows us to predict how the virus is going to behave, where is it going to be going next, and like how impactful is it going to be in that certain area. So I think it's very fascinating now that we are able to know all these aspects in real time and in for any part of the world, basically.
Yeah, and actually also more on those contact tracing apps, for example, but also other ways of leveraging data-driven tools. Could you elaborate maybe a little bit more on that? Maybe I can ask Gautam to elaborate on that, given that you are the one also with most experience in as a data scientist, from a data scientist perspective.
Well, data actually is collectible in various forms, and it's not limited to just one type of data as well. And when we look at COVID in particular, it's a pandemic that has spread so viral that to control such a pandemic, we need to actually access and monitor how the virus is spreading. And that's the reason why there have been so many initiatives to develop apps to to contact trace how the virus is spreading. And it's one form of collecting data that would help governments battle and control the virus that would be traceable.
And in terms of maybe not just the contact tracing apps that gather data in that sense, how did you find the availability of data? Yeah, were you surprised? Were you disappointed by the availability of data? What was your feeling about that?
Well, since we've been working on this editorial pieces, we've actually found several data sources that we were coming across. And for most of the data sets that we found, the data was quite recent, and we could point out the transition from 2019 to 2020. Certain points along the way, we found that the data was available till March, although we are in June. But it does take a lot of time for the data to be processed and also to be published. But however, I think the open data that was existing a few years ago and what it is currently has been drastically different in a positive way. So that's a change which as data scientists we really appreciate, because the more that the data is available, the more does it empower citizens to actually use that data for useful purposes. It could be in terms of spotting opportunities and trends as well in both the public as well as the private sector, but also to keep into account of how the government policies are changing and to keep the government policies in check as well.
Yes, and also especially as you mentioned, now this whole pandemic, the whole situation really kickstarted also data publication, data gathering, but also publication. I mean, in just a few days, weeks time, you could see initiatives popping up that provided the data that was available. For example, in Italy, if I'm correct, they were pretty fast in setting up a whole dashboard of the available data on to track the current situation. So I think that's quite
indeed.
admirable.
Indeed, and as we've also, published in the data initiatives part within EDP, we could see the number of dashboards that are available for COVID, which weren't existing in 2019. So you do see that, with the technology that is available, anyone can, use data that's publicly accessible, and keep them well informed, but also to publish this for the help, for assisting other people as well.
Yes, indeed. And I believe you also mentioned some in the data story that you wrote that it helps better decision making, but it also helped to better allocate resources during the COVID-19 times. Bervin, would you mind elaborating a bit on that?
Yeah, so actually what we have seen is that the data in the medical field, the use of data in the medical field is very much extensive now, but not only, as I said, in the keeping the track of the patients and the data, but also like the other medical related how do you say it, like questions such as like how much availability does one hospital have, and how many patients do they expect to have, or how many intensive care units that they have available, which actually turned out to be a very important important subjects in this pandemic, because we saw that the lack of the availability of such sources also were playing critical role in saving lives. So what we have seen is that because the hospitals and the governments were sharing this data, not only within their countries, but also on an international level. We saw, for example, there was an example that over 100 patients from the Netherlands were immediately transferred to Germany, and because Germany had a lot more availability in terms of the beds, and this actually played a very critical role in saving those lives, because the Dutch hospitals back then were not able to accommodate these patients. So yeah, this is, I think, very fascinating to see how the data can play a role.
Yeah, I completely agree. And not only because does it make it more transparent, but it also allows for example, these kind of international collaborations, because we are aware of the situation as is in real time.
Yeah, indeed.
Yeah,
I think that's a really good point you're making, especially because there is a lot of equipment, say personal protective equipment or masks, etc., that were at one point really, really scarce. And as you can imagine, indeed, this can actually cost lives. Or if you have a lack of ICU beds and you can't take in a patient that has COVID-19, then sort of what do you do? And I thought it was quite interesting to see that also on a global level, you see more and more that the resources were allocated to the place where they were needed the most. So sort of you saw people come together and try and fight it together, and have awareness of who needs it.
and how do you see the role of data in let's say the further developments of this crisis? Do you have any idea about that? So how can we use data for not just in this situation and how to cope with the current demand, for example, on the hospitals, but also how to look forward and how to reopen European countries or Europe in general?
Maybe I can answer. I can respond. Well, so far we've seen that the pandemic has spread, and we've been trying to fight the insurgents in terms of number of cases. So the battle that we've just fought is to flatten that curve and to make sure that we have enough IC beds that are available to treat patients who might be having more severity due to the virus. However, there's still a long way to recovery because we don't have a vaccine yet, and therefore we still have to fight this pandemic in a continuous manner. And there would be a high possibility that the virus would come back into societies, and data would really be useful to fight and to contain the spread, and to also help companies get back to their economic recovery, because a large part of the COVID battle has also been on giving the people some form of stimulus, and this can't be everlasting. And therefore, data has a huge role in fighting this battle and to keeping it in check until we can get a vaccine. And I think it would be really crucial that we have to leverage data. And the fact that there have been so many initiatives that have been created in the last few months can serve as a benchmark for people to use to make better decisions in their day-to-day lives.
Yeah, true. And oh, go ahead.
Sorry, maybe to add to that as well, I think what we learned when we experienced the pandemic in the early weeks, that a fast response is really crucial. So now, since we have all the availability of data and closely monitoring the situation in all the countries, enable us to next time, if the second wave happens, for instance, to react even faster than before, so the virus can be contained without before actually it causes a lot of damage. So in that sense, I think the data also will play a significant role.
I see we have a question coming in. Thanks for the addition, by the way. Let me get the chat open. So the question is basically, what about the industries that were impacted the most? I mean, there's obviously some differences in some industries being impacted harder than others. And what about those industries that were impacted the most, that made the most of the data to drive their transformation as they are reopening? So one of the examples that's given is the tourism industry.
Maybe Gianfranco would like to elaborate more on the question, because
Yeah, hi everybody. First of all, thank you for being here talking about your experience with working on this project for the Commission. My question is mostly related to reopening. So we talk a lot about taking care of patients and people who are sick. I'm also wondering about everything that we leave permanent impacts after this wave is gone, hopefully soon. That is how some industry will simply change for a very long time, if not forever, thanks to the learnings coming from it. So tourism is impacted heavily and perhaps may recover and go back to what it was before, but other fields like education, for example, may not necessarily want to go back to physical classes and so on. Is the data enabling these industries to be perhaps more informed? Is it too early to use it? Have you checked against some of the industries if data is available and can help them decide how to reopen?
The COVID-19 has definitely changed the way how industries would function going forward. And we see that, there's a lot of industries which have relied on closer contact compared to other industries. For example, in a data story that we were covering, which was related to the economy as well as the financial industries, we saw that most of the tech companies were able to outperform other industries such as the tourism as well as transport companies. And the fact is that these companies rely on the data that is published by the governments in terms of whether they can restart their business safely, and if they can, to what extent can they actually scale up their business. And the question would come in terms of how can they remain profitable at those diminished levels. And that's something that is ongoing, and it would take more time for companies to have a clear idea of how they can actually be operational. So this is a continuous development which can only be tracked via data. And the more we learn from how the virus is going to be spreading, whether there's going to be a second wave, and can we contain it with certain measures, that would help these industries effectively open up. I hope that answers the question.
Yeah, there are 2 points that you added that I believe are relevant to this conversation. That is, on one side, a lot of the data we rely upon is from government. That is great, but I wonder if it is enough. And the second is, it takes time to create enough data to take a decision on. So in what most of the data I believe you probably have examined for the data stories is either very old, so pre-COVID, or put up together very, very quickly in response to the emergency. But I'm not sure we have enough stuff that describes what happened over the last 3 months in a bit detached, cold way. And that will probably come later. So a lot of the learning will probably take place over the winter, perhaps, and not even now. Do you agree with me?
Absolutely. I think that's true, because certain industries, we did find that, the data was not openly available. So, for example, the hospital data was more readily available because it was more critical. But if we take, for example, hotel industry, we couldn't find the exact number of beds that were there in March 2019, which were unoccupied, and which could have, led to business and revenues. So those kinds of data would actually help in estimating the economic impact in those industries as well. But clarity on that data also is lacking. And I think in the coming months and weeks, we would be seeing these data coming out in the form of surveys, etc. But I don't think that the government can handle collecting data on all points, and there's a limitation on their side as well. But again, the cost of collecting data is also an issue, because governments have budgets to collect data, whereas public companies have to spend to collect data. So there comes a cost-benefit analysis of whether you need data or are you going to use it to do something else. And that's where you have to make a decision on how to proceed.
I have a feeling you may be opening a can of worms there. But I actually have a question for Laura then, also rich for the experience of coordinating the team as a whole, and crashing against these kind of obstacles that you've been describing, so data perhaps not being consistent or complete or homogeneous across the sources and so on. Do you think that this crisis in a way highlighted something like a minor second silent crisis? That is the lack of sharing, the lack of collaboration, of perhaps we may not think about private organization because they're free to do whatever they like, but at least governments. So what is the situation with open data in general, even before COVID, in your opinion? I know you've been working on that beyond COVID, and can we use this experience perhaps to wave a flag saying, guys, you're not doing enough, we need to accelerate?
Yes, so I think there's basically 2 points to make here. I do agree with you that that there's always room for improvement. We, especially when looking at the data stories that we've been working on, and the ideas that we had that we would like to write about, but we were just not able to because the data was simply not there or not updated up until the moment that we would really like to see the most impact on. Yeah, that's still a shortcoming in some cases, but I also would really like to note that on the other hand, there is a lot of data available. There was a lot of, even though it's the potential is much greater, the data that was currently available already allowed us to make inferences and draw insights, and indeed they should be validated. Maybe not possible now, but maybe indeed, as you mentioned, more towards the winter of this year, when hopefully more data has been has been made available, also especially showing different topics over the course of the past few months and also the coming months.
And you made me curious now. So you say that some of the topics you may have wanted to write about actually did not give you enough opportunities to do it because perhaps the data was missing on something. Can you, you made me curious, can you share what you had in your pipeline that you could not write about because you could not find the data, or where you had more difficulty? That would be interesting.
This was, let's say, a component of just a smaller component, but what we really would have liked to look into is, for example, the number of masks that have been created and distributed during the past months, and how that fluctuated over the time. But there have been various examples of that. Maybe the rest of the team can help me out on some other examples. But I think, for example, also in the education system, what we really would like to look at is, okay, how are different schools, different universities now coping with the current situations? What measures have they taken, and how does it reflect in the number of students that they're able to cater to? But that kind of data is just not yet available. I see Jessica is unmuting.
Yeah, maybe another one to add there in terms of topics that we had difficulty finding data about would be the sports and entertainment sector, where we thought it would be quite interesting to write about how many people or top sporters are without their work, so to say, or, you know, how does it go with the fitness of people right now, as well as, you know, all the events and how many business conferences or festivals, etc., were sort of closed down because of COVID, and it was pretty hard to find.
Yeah, but if I can also add maybe one thing that's definitely interesting to see also, because COVID-19 changed we as consumers, as people, as citizens, how we live, and then it has impact on not only medical industry, but also sports, entertainment, transport, and all sorts of industry. And then our goal with the data stories was also to cover those industries. But then sometimes we really faced with finding the data in those kind of industries. And I think that maybe also raises a flag, as Gianfranco said, because what we have seen is that in order to collaborate more, for instance, the research paper websites, for instance, or the newspapers or some companies, they opened up their COVID-19 coverage to really foster collaboration and sharing openly. But then in our data story as well, we were wondering while writing, is this going to be continuing after COVID as well? Do people actually see the value of this, and what's the give and take there to open your data and or to again raise the paywall, so to say, and change it?
That is actually something that comes from your data story, because you refer to what we learned from past epidemics and pandemics, although the data was not collected on computers, of course, as we do today. And I remember talking with you actually about this, that is, will we be smart enough not only to collect and publish a lot of data today, but also to keep it there in good condition and safe and well stored and findable, perhaps for the next one? I'm touching wood or whatever, but you got the point. Do you think are we good enough for that to happen? Did we learn something on that as well?
I believe we are learning, because also when we compare it with the previous pandemics, we also now see in this pandemic that, for example, AI and machine learning systems are also being used together with the people and the medical personnel in detecting the virus and whether there is a pandemic coming. So obviously for these systems to make accurate predictions, the data is really important. And currently that's why keeping the data up to date and complete is very important for us to be prepared for the next waves, or even a different type of coronavirus or other type of pandemic risking viruses.
Okay, so hopefully we learned. Good.
Yeah, that's actually also a question that I have. How do you feel about us being, yeah, the status that we're now? We have learned there has been some data available for us to draw conclusions on, but indeed for the next pandemic, whatever crisis that we as the world will face, how do you see our chances of being able to provide value there with the data? Just to add on Gianfranco's question.
Yeah, I think that's a really interesting question. We also briefly touched upon it in the data story, where we considered the question, what do we learn from this and how can we improve? And I think it is two-sided. So first of all, we just talked about data openness, say medical research, for example, that is becoming available freely for everyone. But also in that sense, the Open Data Directive from the European Union, which will be transposed into law next year. These are all efforts that really contribute to ensuring that the data is available, and thereby we are better and better able to make the right decisions. But I think even though it's a really good start, we still have a way to go. It's not the case that we can find any data that we would like to find, of course. And I think also what came from our previous part of this conversation is that it really depends per sector or per industry whether the data is available or not. And it's quite interesting to see that on some parts there's a lot of data. So if we were talking about the dashboards, which are great, they have great visualizations, there are many of them, and there are many of them who, for example, show the number of deaths or the cases. If we were to talk about testing, then that's a lot less popular topic, so to say. So I think it's really important to sort of reflect on what is the data that we really need to be able to respond effectively, and make sure that the focus lies there, of course. And then the second point is, if we have the data, then do we make sure that we use it effectively? I think what we've seen with COVID-19 is that we kind of knew that a pandemic as this was potentially going to happen. A lot of researchers have already stated that. And at the same time, it's all about sort of speculation, right? It didn't happen yet. So do you take action then, or do you not? And then at the same time, when it actually does happen, how do you ensure that you are able to respond timely, and how do you get an estimate of how bad it is? Because of course it's like, you know, there's a new virus, but nobody really knows what the impact is going to be. And I think therefore it's also quite interesting to use all the data that we have now from COVID-19 and save that and use it in the future, and sort of see, you know, with COVID we have had a trend where all of a sudden it, you know, went worldwide. And if you were to notice that in any other pandemic in the future, I think lots of people would be more aware, more easily, and also more open to act upon that data.
Yeah, exactly. I think that's indeed the end goal that we all wish would be the case in the end. And so there's, on one hand, is being prepared for the next big thing. Well, first of all, prepared to be able to cope with the current pandemic and easing up, opening up as we go along. Then potentially preventing, or at least being better prepared for another pandemic or crisis, whatever. But it's also about the fact of just making the public more aware of the data that is out there, and just to have them give them the tools, for example, with visualizations that we create, with just getting a better sense of what is going on, what is happening in the world. Do you have any final notes on that, on visualizing the data? Maybe Gautam, you would like to add to that. How do you see the role of data and data visualizations in creating better public awareness?
I think data itself, data or data sets are facts that represent what has happened, and it's quite hard for people to verify them if they do not visualize it. And by visualizing it, it actually helps not just people who are data savvy to understand what's behind the data, but anyone to actually understand what the message is and what's the reality based on that data set. And that's why in the editorial as well, we've been focusing on creating visuals which would help support the facts that we are trying to explain. And when we have to talk about a data set, we would also like to point out what would be the trend and project what would happen in the future. So it's not just based on understanding what the data set itself is, but it's about also making an insight on what could be the next possible options that would happen in the future. So I think in terms of that, visualization is an important tool that we as data scientists need to bring out to the general audience, but also the fact that there are so many tools out there that you could choose to make the visuals more attractive. For example, there are certain animation bar charts which have been used by data scientists, which were not available earlier, but they were so captivating that people were driven to those kinds of animations. And simple things like the stock price increase, or also number of cases in coronavirus increasing per country, things like that can actually be visualized and animated. That would help viewers not just view it as a boring data fact, but something that's very interesting for them to read and educate themselves upon.
But Gautam, you're a data scientist, right? It's easy for you. But what if I'm not? Can I actually even just try to understand these visuals, or it's just the fancy stuff that moves and with colors?
Well, it doesn't require a lot of effort, and while writing these stories, we've also come across these sources where the data sets are also combined with visualization tools. So even without downloading the data, you could just visualize it using just a few clicks to see what the trend is. So you really don't need to know Excel. You really don't need to know Python to actually visualize and see what the data is. There are several data initiatives done by people who make it more simpler for anyone.
Okay, thank you. I trust you on that. Yeah.
I think I can support that point from my own experience. I mean, when I started this project, I was not necessarily someone with a background in data, but what I really noticed is that, first of all, the data visualizations make the bar so much lower to actually go in and see what is happening in the world. So I think that is a really useful tool. But what I also noticed is that the fact that we were working on these stories and you read about it, you see what's out there, really made me realize that it's quite accessible to anyone. There's a lot of data around, and if you just dive into it a little bit, then you are actually able to sort of form your own perspective on what is going on in the world. And I think it's really useful for people to know that that is a great opportunity, whether it's for running a business, for seeing what your customers like or not. So that was quite eye-opening.
Thanks, Jacka.
And actually, on the topic of lowering the bar for people to interact with data and get the insights from it, I actually showed one of the visualizations to my grandmother, and she was, first of all, very proud, of course, but it was very cool to see that someone who is, let's say, it's not even data savvy, not tech savvy, it's like a little less than that, and she was still able to at least get an idea of what we were doing and what we were trying to visualize with the data we had. So I think that's
cool.
Right, on different type of dashboards, for example, appearing and trying to summarize the situation, and then we see more and more that they are following more a user-centric trend, because they want to reach a bigger group of audience who have different levels of data literacy. So I think the goal is to reach the public as broadly as possible, rather than keeping the data to the only data savvy people bubble.
Yeah, completely agree. Let's see. I think we have discussed already quite a lot of the important topics that I wanted to discuss with you. Let me just quickly check if there have been any additional questions made in the chat, but
None in the chat, but I do have one, and it links back to something you were also mentioned a bit earlier in the talk, and that's when you were writing these two pieces, was there data that you wanted to see in particular for looking at this humanity versus the virus that was not made open for whatever reason? I can elaborate because they're all on mute. I'm not sure if someone's trying to respond already.
No, it's a good question. I think what was quite interesting is that we at one point looked at could we have prevented or stopped the outbreak earlier, and if so, what would be the difference? And in that area, we kind of looked at, what is the cost of a pandemic or an epidemic, and how much would it cost to develop a vaccine? And that was quite a long search, which I guess makes sense because it's not easy to estimate how much a vaccine would cost, or especially if it's preventative. But at the same time, you see really high numbers for the total cost of a pandemic. And I thought it was quite interesting to sort of have that comparison between, actual costs and vaccine costs. But with actual costs, it's just a number, right? You don't have any clue about which area or which countries were hit the most, or which sectors this cost comes from, etc. So I think we have a part of the data, but maybe not as broad as we would like it to have.
Thank you. Sort of a follow-up question to that then. In the different dashboards that you saw, was there some data that was not shown in some but shown in others? I'm always interested in what was not revealed or what is not shared rather than what is consistently shared. Whoever wants to jump in.
If I can continue on that, I think one that we mentioned before here is the dashboards where it's about the number of deaths, the cases. And what I noticed to be quite interesting is that some include the recovery rates, whereas others don't. And I feel that to get sort of an accurate representation of what the virus is doing or how it's developing in a certain country, we would kind of want that figure, knowing how many people are okay now. And at the same time, sometimes when that number is included, you see that it's quite low in comparison to the actual number of cases. So somewhere in the line or somewhere on the way, we lost those recovery cases because at one point less of them were included.
You opened that kind of worms there. Another one. Something I hated is how a lot of let's say the venue focused on the total number of people who were sick or died against to the number in respect to the population. So you had comparison of Netherlands with France or the United States, like they were the same thing, and the number of people suffering of the sickness was relevant in absolute terms. That in a way shows how possibly, perhaps visualization, everybody can read them, but we also need the people behind those visualizations to be responsible and wonder what best number, what best graph really tells the story, rather than the ones that sell the most. And I will stop my rant here because it can get worse.
Yeah, that's actually a very good point, Gianfranco, because that's something that we have encountered also while writing the testing data story, because the number of cases, you can only identify them based on how many people that you test. And that also, like the countries and their capacity in testing also differed very much. And if you only look at the number of cases, then that is not quite representative in understanding how severe the situation is in one country.
Yeah, and I've heard someone saying that if you test fewer people, less people are sick. That was a joke. Don't say anything more about that.
All right, I won't.
All right. On that note, let's leave it at that. Let's keep the joke up in the air. No, I'm kidding. I do see that we are slowly running out of time, and I think we can continue to chat about this for some time still. But to start rounding it off, I would like to invite the three guests to briefly mention one thing that they learned from their experience on working on the EDP for COVID section. I give you a few seconds to think about that one. And then I would say, if there's no further questions, we will discuss that and then start rounding off. Bevin, would you like to go first? What is one of the learnings that you had working on Edpc?
Sure.
Good. Yeah.
Sure, that's actually a very good question, and enables also me to reflect. What I learned is, and what I liked and what I learned with this project is that diving each week to a different subject that we are not necessarily experts on was really a good challenge, and following the data-driven way actually made it a lot easier. And discovering different types of data built like a bit more a better understanding for me, and writing about it also teaches you a lot, looking from different perspectives, and like also with the goal to educate the people. So yeah, guess that was like that's the reflection from my side.
Nice. Jetske, would you like to go next?
Yeah, sure. So indeed, I thought it was a really interesting experience, and you do see that on most topics or some topics, there's a lot of data around, so you can really gain your knowledge and see a lot about how is a particular sector doing. What I do think is interesting to mention as a takeaway is that even though the pandemic is, not a good thing for anyone, you also see a lot of opportunities coming up. And for example, when you look at education, you see more and more people who refer to e-learning, where that could actually be a good thing, where more and more people can join a course, whereas usually you're restricted by physical abilities. So I think even though it has had a great impact and also harmed a lot of people, you also see a lot more innovation. And when looking at the data and when looking at how people are going about it, then you also get insight into that area.
Yeah, very good point, and completely agree. Gautam?
Yeah, I think in the past few weeks, I've learned that data actually brings out the truth and helps us stop the misinformation that spreads in news articles, etc. And it helps you understand the world much better. For example, if we were just writing blogs, which were just based on text, and what other people were saying, I would think that it wouldn't be as informative as writing data stories, where we were able to leverage factual data to bring out the story behind it. So I think it was a really good opportunity to learn, about the impact of COVID and how different sectors were responding, and how we should also move forward, whilst making other public as well aware of the things that are happening because of COVID. So I think it was a really good learning experience for the past few weeks.
Yes, that's great to hear. No, I think that also for me personally, it also touches upon most of the things that all three of you already mentioned. But I think the biggest learning indeed is to assess the data that's available and to really make good insights of it and write about it. That's a challenge in and of itself. But it also taught me that, especially with a team that consists of people that do not all have these data skills and this experience in their background, we're still able to make bring up valuable insights and bring valuable visualizations of the data to the table, while also at the same time acknowledging that we are not the experts. So the experts in the field, they should be the ones that really draw the conclusions and shape the way forward based on the data that is available. And on that note, I would like to thank all of you very much for your input during this session. I really enjoyed it. I hope the rest and also the viewers later will find it enjoyable as well. For the next data talks, I will also already give a quick sneak peek. So in the next session will be focused on 3 powerful women in open data from Italy, and we will explore their, let's say, origin stories, how they learned about open data, how they got involved in it, and what their role is today, and how they push open data progress forward. But more about that in the next data talks. Thanks again. Have a good day.
Thank you.
Thanks for having us.
Thank you.
Thank you.
Thank you.
Thanks. Bye.